Hello Jamie, welcome back. You've done your third placement now with John Flynn.
I'm just about to go on my
Oh,
third
you're just
placement.
about to leave today for your third and final one.
Yeah.
To where are you going?
Utopia.
Utopia. So that's in relation to Alice Springs. That's northeast.
Yeah, about 230 k's, I think.
Yeah, out in the desert. So how have the last two placements been?
Yeah, I've absolutely loved them. It's been really good actually being in the community and being part of what they actually do, and also figuring out how things work in the bush compared to a city hospital as well. So
Yes,
yeah, it's been
very
wonderful.
different. Very different. And what drew you to the program in the first place?
Well, I actually have had a fair bit to do with Indigenous people previously. So I worked on the Army Aboriginal Community Assistance Project in 2002, and then again in 2012 and 13. And I also did volunteer ambulance in Port Hedland, which had a large Indigenous population, and I really like working with Indigenous people, and saw the program and thought it looked great, so here I am.
Fantastic. So it has a strong cultural component to it, that you're exposed, at the coalface. What positive things did you get out of being out there?
Well, I got to go out and collect bush medicine, so that was really interesting. So we went out, I think it was about an hour and a half drive to a place in the middle of nowhere, and we found there were about 4 bushes of this particular plant. I have no idea how these women found the bushes, but they were the bushes we had to pick, and then we just made up some ointment which everyone in the community was waiting for, which was really great. But I think the big thing I like is the different way Indigenous people treat health. So out in Utopia there's outstations, and the nurses pretty much go out to the community, and the great thing is health is something that is a community thing. It's not just a doctor sitting with the patient. Everyone cares about what's going on with everyone else, and there's kids playing, dogs come in. It's just a really, really nice feel, and I think there's a lot we could learn as white people, to be honest, from how Indigenous treat their health and care about each other.
Approach. That's fantastic. So they obviously welcomed you with open arms to be invited to do all these things when it's only a short sort of placement. That's fantastic. So how do you think the program, John Flynn program, will influence, going forward with your career, and personally, what are you taking away that you think you can help make decisions as far as your career and personal development go?
Well, I think the important thing is, although Utopia is wonderful, there are so many health problems, and they actually have problems getting doctors and getting quality medical care just due to the remoteness of the location. I think as health professionals we really need to take a good look at what we can do for our own community rather than focusing on all these problems overseas. We've got the same magnitude of problems right here in Australia, and I think it's really important that we acknowledge that, and the only way you can do that is actually living there for a few weeks and seeing what the problems are. And I'm hoping that when I become a doctor, which is still 3 years away and a lot of study, I'm hoping that I can give a bit of my time each year going to a community and helping out where I can. And I think if enough of my peers do the same thing, we can make a really positive difference for the lovely people in Utopia and that type of thing. I just think it's really important that we help our own people, and I suppose learn from Indigenous as well.
Excellent. Well, hopefully you can spread the word on our need for quality health practitioners in the Northern Territory, that more and more people come across our way. That would be fantastic. But thanks for being part of the program, and good luck with your final placement. Enjoy, and hopefully we'll follow your career somewhere down the line. We'll find out where you are, and can follow that NTGP were part of where you're going to be. So thank you.
No worries, and thank you for organising this. I know it's such a huge logistic and burden, but it does does make a huge difference, and I know all the students that have gone on the placements get a huge amount out of it, both personally and professionally, so thanks for taking the time and effort to put that together.
Yeah, no, it's great to see so much positivity come through, and everyone, like you say, everyone does have a great time. They really do.